So let's start by understanding what is schizophrenia. So the word schizophrenia was introduced by a psychiatrist named Eugen Bleuler in the early 20th. He was one of the first to describe this mental disorder in detail. So the term comes from two Greek words, schizo, which means to tear or split, and phrene means the mind or intellect. So in ancient times, people also believed that the mind was the center of emotions. So schizophrenia literally means splitting mind. So for example, like imagine if your thoughts, feelings, emotions were like a puzzle, and in someone with schizophrenia, the pieces of the puzzle don't fit together in the usual way. So their thoughts, emotions can become fragmented, making it hard for them to understand what's real and what's not. So this condition affects not just thinking but also a person's emotional stability. That means their feelings and how they react to things can be very different from what we might consider as normal. Uh, the next part is that there are four A's of schizophrenia. So Eugen Bleuler identified these four key symptoms that often appear in people with schizophrenia. He called these four A's. It's association, affect, ambivalence, and autism. Association refers to how thoughts are connected. So in schizophrenia, thoughts may become jumbled or disorganized. The effect is about emotions. People with schizophrenia might show unusual or flat emotions. They might not react emotionally, uh, they might not react emotionally to things that will normally make someone happy or sad. The next is ambivalence. This means having mixed or contradictory feelings. For example, someone might love and hate something at the same time, leading to confusion. Next is autism. Like in this context, it refers to being detached from reality, focusing more on the inner thoughts and less on the outside world. Are the slides moving?
No, ma'am, we can just see the first slide.
No, ma'am. Only the first
Okay.
one is visible.
Okay, just a second. Are they moving now?
It's on the first slide only, ma'am.
Yes, ma'am, they are moving.
Okay, I'll not do the slideshow then. I'll just present in this way. Um, so, schizophrenia is referred to as fragmented mind. So, like fragmented is something that is splitted or something like that. So, schizophrenia is a very complex and long-term mental health disorder. It impacts how a person thinks, feels, and acts. So, like fragmented in the context of schizophrenia refers to the disruption or disorganization of a person's thoughts, their emotions, and the perception of the reality that they have. So, schizophrenia causes a disconnection between the thoughts, emotions, and reality, leading to uh, disorganized thinking, delusions. So the thoughts can be jumbled and unclear. There might be strong beliefs that are not based on reality. Example, like believing someone is spying on them, like without any evidence. So it's one of the most difficult psychiatric conditions to treat because it affects different people in various ways. So managing it often requires long-term treatment and like support to help the individual live a more stable life. So now we look into the signs and symptoms of schizophrenia. So there are positive symptoms, negative symptoms, and cognitive symptoms. So positive symptoms are things that are added to a person's experience. These are symptoms that shouldn't be there. So they are delusions. So delusions are strong beliefs that are not based on reality. For example, someone might believe they are being followed, or they have superpowers, even though like it's not true. Then there are the other symptoms are hallucinations. Halluc- Hallucinations are seeing, hearing, or feeling things that aren't actually there. The most common type is hearing voices that others don't hear. So a person might hear a voice telling them to do something, even though no one else is around. The other positive symptom is disorganized thinking and speech. This symptom involves having trouble organizing the thoughts. So it might come out as jumbled or nonsensical speech. A person might jump from one topic to another in a way that doesn't make sense to others. There is also disorganized or abnormal motor behavior. This could be anything from unpredictable agitation, where the person may not move or respond to others for hours. Like a person might like make or strange movements, or have trouble starting or completing any task. Then there is negative symptoms. Negative symptoms are things that are taken away, or that are missing from a person's experience. These are behaviors or abilities that the person loses. So it has affective flattening. This means showing little or no emotion. The person's face might seem expressionless and their voice might be flat. So, for example, not smiling or reacting emotionally to good or bad news. Then there is alogia. This refers to uh, poverty of speech. The person might not speak much, or only give short or often one word answers, uh, like answering questions only with yes or no, and they're not elaborating on it. The next negative symptom is avolition. So there will be a lack of motivation to start or continue tasks, including simple ones like even getting dressed or even eating. So the person might spend most of the day doing nothing, or showing no interest in activities that they once enjoyed. There is another one which is not mentioned here, which is anhedonia. The It is the inability to feel pleasure in everyday activities, like eating or socializing. So it's like they are no longer enjoying hobbies or spending time with friends or family. The cognitive symptoms involve problems with the memory, thinking, and understanding. These symptoms can be subtle but are important because they affect obviously the everyday functioning of a person. So it has poor executive functioning. So like difficulty in understanding information and using it to make decisions. There might be trouble organizing thoughts or figuring out how to tackle a problem. So the person may find it hard to concentrate on tasks, even the simple ones like watching TV or reading or writing. They will frequently lose track of conversations, or they are not being able to follow instructions properly. Then there is also problems with the working memory. So this refers to the ability to use information uh, right after learning it. So people might have trouble remembering that they were just told about something. So forgetting details of a conversation that just happened, or they are not being able to remember steps in a simple tasks. So for example, if they are making tea, so they'll boil water and then they might forgot adding the chai patti, and then they'll just move to the next step. So the working memory is affected. So next is the etiology of schizophrenia. So it is understanding the causes of it. So schizophrenia, as I said, is a very complex disorder, and its exact cause is still unknown. However, there are researchers that believe that it develops due to different combination of different factors. So we'll just break them down. So the first is genetic predisposition, which is the family history. So schizophrenia tends to run in families, which suggests that genetics play a significant role. So, if someone in your family, like a parent or sibling, has schizophrenia, your chances of developing it are higher. Uh, then there are also the environmental and social and psychological factors. So, certain factors during pregnancy and early childhood can increase the risk of schizophrenia. So this might include the prenatal exposure to infections or malnutrition. So if a mother experiences severe malnutrition or infections during pregnancy, it could affect the baby's brain development. So the role of then there is next is the role of brain and the chemical imbalance. So schizophrenia is often considered a neurodevelopmental disorder, that meaning that it involves abnormal brain development, particularly during the childhood and adolescence. So some people with schizophrenia show differences in the brain structure, such as smaller regions of the brain or larger ventricles. So larger ventricles are the fluid filled spaces. Then there are also the psychosocial factors. So high levels of stress, especially during critical periods of life, like maybe during adolescence, it can trigger schizophrenia in people who are already at risk, uh, experiencing trauma, abuse, or neglect during childhood can also contribute to the development of schizophrenia. So we'll now look into the epidemiology of it. So, like, how common is it? So schizophrenia affects about 1% of people, though some studies show it can be as low as 0.6% or uh, as high as 1.9%. This means that out of every 100 people, around one might have schizophrenia. So schizophrenia also like usually begins in late adolescence, around 16 to 18 years, or like early adulthood, between 20 to 30 years. It's rare for it to start before teenage, or years after the age of 40. So for men, it often starts between 20 and 38 years, while for women, it usually starts between 26 and 32 years. The gender differences are so it is more men are diagnosed with schizophrenia compared to women, with a ratio of about 1.4 men for every woman. Women tend to be diagnosed a bit later than men. There are also different types of schizophrenia. Um, there is paranoid schizophrenia, catatonic, disorganized, undifferentiated. We'll first look into the paranoid schizophrenia, what it is actually. So, it is a very common form. So, this is one of the most, you can say, well known types of schizophrenia. People often experience strong hallucinations, seeing or hearing things that aren't there, uh, or delusions, which are false beliefs. They may feel like others are plotting against them. It can the age it can start is later in life compared to other types. Their like in paranoid schizophrenia, their speech and emotions might not be affected. So they might be at higher risk for harmful behavior, especially when influenced by their delusions. Next is disorganized schizophrenia. So, disorganized is also called as hebephrenic schizophrenia. It is like the actions and the thoughts seem chaotic and they lack a clear purpose. So, you might see unusual behavior like laughing inappropriately, making strange faces, or having unusual mannerism. Their delusions and hallucinations might not be consistent, and this often starts in late teens to mid 20s. Then there is catatonic. It is a very rarer type. It is a very this is like very less common. So people may have unusual movements, switching between being very active and being very still. They might not speak or respond. So this is called a state which is called catatonia. So they are at the risk of several issues like malnutrition or self injury due to their behavior. The next is undifferentiated schizophrenia. So this type has a mix of symptoms from like the other types, but but it doesn't fit neatly into one category. There is also one more name, residual schizophrenia. So this type is characterized by a past history of a schizophrenia with symptoms that are less intense. It mainly involves negative symptoms like the lack of motivation or emotional expression. So these are the different types of schizophrenia. Next is the clinical features of schizophrenia. Uh, so the first one is thought and speech disorders. So these disorders affect how a person thinks and how their thoughts are expressed through speech. So there is disorganized thinking. The person may have trouble organizing their thoughts logically. So this can make their speech confusing, uh, and also difficult to follow. So a person might jump from one topic to another in a way that doesn't make sense, or might speak in ways that seem very incoherent. Then there is disorders of perception. These disorders affect how a person perceives the world around them. So so it has hallucinations. So the most common form, as we discussed, is the auditory hallucinations, where the person hears voices that others do not. So these voices might be like that these voices might comment on their behavior, give commands, or talk to each other. The person might hear someone calling their name or giving them orders like that, when even there is no one around. Then there is disorders of affect. So these disorders impact a person's emotional responses. So there is a flat affect. So this is when the person shows little or no emotion in their facial expressions, voice, or body language. Even in situations where an emotional reaction will be expected, there won't be any reaction. So not smiling or reacting when hearing like a good or bad news. There is also inappropriate affect. So the person's emotional reactions do not match the situations. For instance, they might laugh during a sad event or cry without any apparent reason. Uh, so then there is disorders of motor behavior. So these disorders affect a person's physical movements and responses. So there is catatonia. A person might exhibit extreme motor behavior ranging from complete immobility, where they don't move or respond to excessive movement. So standing or sitting in one position for hours, without moving, or repeating a certain, or without moving for a very long time, and then repeating a certain movement or phrase over and over. There is also agitation, so restlessness or being easily irritated, which can lead to unpredictable and sometimes aggressive behavior. So packing for example, pacing back and forth, or becoming upset without a very clear reason. So schizophrenia typically progresses through several phases, with each phase which is characterized by different symptoms and intensity. So understanding these phases can help in recognizing the development of the disorder and then guiding the treatment. So these phases are, the first is prodromal phase. So this is the beginning stage where symptoms start to appear, but they are not yet fully developed. People might notice changes in their thoughts, feelings, or behaviors. The next is active phase. This is when the symptoms are more intense and they are more noticeable. So people experience prominent hallucinations, example, hearing voices, delusions, example, believing in things that aren't real. Then there is disorganized thinking and severe disruption in their daily life. The last one is the residual phase. So this is after the peak. So this phase follows the active phase, where the most severe symptoms may lessen, but some symptoms still persist. So individual might still experience some symptoms such as the negative effects, which were the lack of motivation or reduced emotional expressions. So the prognosis of schizophrenia. So prognosis is it refers to the expected course or outcome of a disease or condition. It includes prediction about how the illness might progress, how it might affect a person's future, and what likely the outcomes are based on the current understanding and treatments. So, the future outlook for someone with schizophrenia can differ widely from obviously person to person. Some people may experience significant challenges, while others may manage their symptoms well with the treatment. uh, the impact on life expectancy is, on average, uh, schizophrenia can reduce life expectancy by 12 to 15 years. So, this is mainly due to the health issues like obesity, lack of exercise, smoking, rather than just the illness itself. So, also, it has economic and human costs. So schizophrenia can be very costly in terms of the healthcare and the support needed, and it also affects of course, the quality of life for individuals and even for their families. So now we'll look into the treatment process. So the role of medication obviously plays a very important part in the treatment for schizophrenia. So it is medication is a very crucial part of treating schizophrenia, and it is typically prescribed by a psychiatrist. It helps manage the symptoms such as the hallucinations, delusions, and the disorganized thinking. uh, the main medication used are antipsychotics, which come in two main types of first generation, which is typical. So these were the first antipsychotics developed, and which can help with symptoms but may have more side effects. And next is the second generation or typical. These are the newer medications. Often they have fewer side effects and can be more effective in managing the symptoms. So medications help reduce or eliminate symptoms like hearing voices or having false beliefs, making it easier for individuals to function in daily life. So, consistent use of medication can help prevent the return of severe symptoms. Then there is institutional care for schizophrenia. So, institutional care provides a structured environment where individuals with severe schizophrenia can receive specialized support and treatment. This is often used when symptoms are too intense to be managed at home. So the types of institutions are hospitals. So for short-term stays, hospitals offer intensive care and treatment during the crisis or the acute episodes. And there is also long-term facilities. These include the psychiatric hospitals or residential treatment centers where individuals stay for like a longer period to receive ongoing care and support. The services which are provided are the medical care, therapy, and counseling. So, medical care includes administration of medications and monitoring of the physical and the mental health. And for the therapy and counseling, it provides individual therapy as well as the group therapy to help manage symptoms and improve the coping skills. The next treatment will be psychotherapy. So the most important part is starting from the psychoeducation. So educating educating individuals and their families about schizophrenia. So this helps them understand the illness, the treatment options, and ways to support the person with schizophrenia. So it provides the emotional support and helps individuals cope with the daily challenges. It focuses on improving the self-esteem and providing encouragement. So, cognitive behavioral therapy, also called as CBT, is used, like one of the therapy used. This is a type of therapy that helps individuals identify and change negative thinking patterns and behaviors. It can be particularly useful for managing symptoms like delusions and hallucinations because like they are on the thought levels of the person. It starts from the thought levels. Social skills training is also important and which is provided. It is uh, it focuses on teaching and improving the social interaction and the communication skills. So this can include practicing conversation, managing relationships, the interpersonal relationships, and understanding the social cues. Next is the uh, community approaches for schizophrenia. There is assertive community treatment, ACT. So, a team based approach where mental health professionals provide support directly in the community. So, this can include regular home visits and assistance with the daily activities. Next is intensive care management. So it provides like personalized and like hands-on support from a case manager who helps coordinate care, access services, and address practical needs like housing, employment, and healthcare. Family therapy is also important and it involves working with families to improve communication, uh, reduce stress, and develop strategies to support the individual with schizophrenia. So, any questions till now? I will be happy to answer. I'll just go through the slides again if you recall anything, like a question or something. Yes, Divya.
Just wanted to confirm, is catatonia included in disorders of motor behavior?
Sorry, can you repeat?
Is catatonia included in disorders of motor behavior?
Um, is- just a second. So it is involved in motor behavior. So it is we can say it as a psychomotor syndrome that can affect a person's movement, um, ranging from extreme agitation or repetitive movements to complete the immobility and responsiveness. So like people who are experiencing catatonia um may exhibit, if you want to go into like a deeper thing, may exhibit symptoms such as like mutism or uh, rigidity, or like maybe the excessive movement too. So these motor disturbances are commonly like associated with like the condition like schizophrenia, and there are also other conditions which might affect these. So yeah, catatonia is involved in motor behavior.
Okay, ma'am.
Okay, then we'll move forward. So I'll just present this case study, and maybe then we can have a discussion and questions about it. Um, so there is a patient uh, who's a male whose age is 32, a graphic designer, marital status single. Living situation is lives alone in a small apartment. And the present and problem is he has been experiencing like increasing distress over the past 8 months. He reports that he feels like he's being watched constantly and believes that people are plotting against him. He describes feeling a persistent sense of paranoia and distrust towards his colleagues and neighbors. He mentions that he often hears voices that comment on his actions and sometimes uh, gives him commands. The history of the concern is his symptoms began gradually, with his paranoia becoming more intense over the last few months. His friends and family have noticed that he has become increasingly withdrawn and less communicative. Um, he used to be very social and engaged in various activities, but now avoids the social gatherings and isolates himself in his apartment. His performance at work has declined and he has difficulty focusing on tasks. Also, there are current symptoms, I guess, which are not mentioned here. The current symptoms are he believes that his phone is being tapped and that his landlord is spying on him. He has he displays a lack of motivation and difficulty in maintaining daily activities. maybe like personal hygiene or even meal preparation. And he appears emotionally flat and speaks in monotonous voice. So, based on the symptoms described, what is John's most likely diagnosis? So, is John's condition primarily characterized by paranoia, and does it fit into a specific type of schizophrenia?
Ma'am, it can be undifferentiated
Okay.
because he has paranoia, and then
Mhm.
he has problem in speech. I think it was mentioned by him that he has been answering in yes and no's, and then he is feeling like someone is watching him, like hallucinations, which are part
Mhm.
of paranoia as well. So I
Right.
think it might be in the undifferentiated portion.
Okay. So, can you identify uh, the positive symptoms based on the description? Yes. Yes, Divya.
Some positive symptoms mostly include delusions,
Hmm.
hallucinations, and disorganized speaking.
Right.
And he's having problem in speaking, answering in yes and no's. So that might be something kind of like disorganized.
Yeah. Yeah, correct. The auditory hallucinations also, like hearing voices that comment on and criticize him. So these symptoms, these positive symptoms contribute uh, to his distress by creating a significant fear and mistrust, impacting his ability to function normally in social as well as the work settings. What could be the negative symptoms in John's case? Yes, Prachi.
Flat effect as he's not showing much of the emotions and usually stays quiet and doesn't respond.
Yeah, that's correct. The flat effect.
Ma'am,
It is the
is
yes, yes.
also he is lacking the motivation to continue anything which he used to do before.
Yeah, absolutely correct. So like the lack of motivation, uh, the decline in work performance, and the difficulty with daily activities. Right. There is one more.
The social withdrawal.
Yeah, correct. The social withdrawal, avoiding the social gatherings and isolating himself. Right. So these are the negative symptoms in John's case. So these were the like identificate. This was the identification of the positive and negative symptoms based on the case described. So mm, if uh, if you can you just based on what we saw the treatment, can you recommend or like try to identify a treatment plan for this case, like a very basic thing. Yes, Divya.
Ma'am, I think psychotherapy and community approach might work well with it.
Yeah, psychotherapy and community approach will definitely work. So like we can't just obviously we can't just state one treatment. As we saw, a combination of different treatment works. So yeah, psychotherapy and community approach will definitely make an impact. Which psychotherapy can be used?
Supportive therapy and administration of physical and mental health.
Right. Yeah, that can be
And
used.
then we also have CBT.
Right,
CBT.
CBT. Yeah, as we discussed, the cognitive behavior therapy,
Yes, ma'am.
which can it is very useful in addressing the delusional beliefs and improving the coping strategies. Also, supportive therapy. It will also help John rebuild the social skills and motivation. So yeah, that both will be good. Also, basic the pharmacological treatment, which are crucial, antipsychotic medications to help manage the symptoms of paranoia and hallucinations. Um, so, if we discuss about the most basic thing, engaging in the social skills training and also involving the family therapy can provide the additional support in managing the condition and improving John's overall well-being. Okay, so as we discussed today, schizophrenia is a complex mental health condition that affects not only the person diagnosed but also their loved ones and communities. So, understanding its symptoms, causes, and treatment is crucial in reducing the stigma and providing support. So, with medication, therapy, community care, many individuals with schizophrenia can lead fulfilling life. So these conditions, the disorders and mental health condition is not just about treating symptoms. It's also about offering empathy, understanding, and providing the continued support uh, that they need. So the more we learn, the more better we get equipped with to foster the environment where people with schizophrenia can thrive. So we can end for today. Is everyone clear about the schizophrenia symptoms and treatment? Okay.
Yes, ma'am.
Okay. So, just the ending note that tomorrow is World Mental Health Day. So, in advance, happy World Mental Health Day. As we are uh, discussing and we are taking lectures for the psychological lectures and disorders. So let's continue advocating for mental health awareness and support systems that uplift those in need. Yeah, so thank you for your time and attention.
Thank you, ma'am.
Yes.
Thank you, ma'am.